Penicillins can be pretty powerful drugs, and powerful drugs are going to cause adverse reactions. So one of the adverse reactions we see is neuropathy. Penicillins can cause damage to nerves in the extremities, especially when given in high parenteral dosages like IV or IM. Signs of possible allergy are skin eruptions. Sometimes the first sign of a penicillin allergy is just one single hive that pops up. That's known as a fixed drug eruption. And that can indicate that maybe there will be problems later. And this is how my own penicillin allergy manifested itself when I was 12. Took my penicillin, probably for tonsillitis or some upper respiratory thing, and noticed I had a hive on my neck. I was scratching it. My mom called the doctor and they said, it's probably not the penicillin. She's probably fine. Well, I took my next dose 6 hours later or whatever, and ended up with hives all over my body, huge hives, wheezing, ended up in the emergency room getting breathing treatments. So I don't do penicillin anymore. Once you find out you are truly allergic, you don't want to do it anymore because your immune system does not like it. Sometimes it will cause urticaria, so hives everywhere, laryngeal edema, and ultimately anaphylaxis. So you want to watch out for any of those leading to anaphylaxis, which is total collapse of the circulatory system. I skip GI symptoms, and we see those there. Often people taking penicillin have some GI problems. Now, many times you'll ask people, do you have any allergies? And they'll say, I'm allergic to penicillin. Well, what does that do to you? Well, it makes me really sick. It makes me throw up. Many antibiotics work on people to cause GI symptoms. It does not mean they're allergic. It just means that that's how their body reacts to it. So GI symptoms are not considered an allergy. They're considered a side effect, although we do recognize that sometimes that side effect can be unpleasant enough that the person can no longer take it. But what we really want to watch out for are any signs that could lead us to believe we have a hypersensitivity reaction. Lots of drug interactions. They are numerous. And once again, somebody who is going to be taking penicillin, a nurse needs to sit down with that patient, look at the product package insert, determine what drugs do not mix well, and tell them what they can do to avoid problems. One drug that does not mix well with penicillins are oral contraceptives. So ladies of childbearing age who are on birth control pills, if they're taking penicillin, they can end up with more than just a bacteria that they had not counted on. They can get pregnant because antibiotics can block oral contraceptives from being able to work. So anybody who has to go on penicillins and some other antibiotics too needs to use another form of contraception for the rest of that pill packet until the new pill packet is started. Now, there is one positive interaction. We talk about interactions all the time, and many of them are negative. But remember that some medications can give a positive interaction with another medication. An example of this is probenecid. Probenecid is a drug that's often given for rheumatoid arthritis and gout. And what probenecid does is blocks the renal clearance of penicillins, and that keeps the penicillin in the bloodstream longer. And so this is effective for sexually transmitted infections that tend to want to hang on and be more resistant. Through the years, we've come up with penicillin-resistant syphilis, and the probenecid allows you to use smaller doses that keep the penicillin in the bloodstream longer. Of course, as part of your nursing applications and patient teaching, you want to look for signs of infection and allergies, and we know that signs of infection, redness, pain, fever, allergies, hives, wheezing, itching. Nursing diagnoses tend to be education and safety related, although in the case of anaphylaxis, you can end up with angioedema, which is going to block your respirations and breathing. Planning, a nurse needs to encourage a patient to follow the regimen and take the drug until it's gone. And that is the second main teaching point that I want to make sure that you remember. So write that down. Number one teaching point is what, class? Yes, you are right. Antibiotics don't work for viruses. Second major teaching point is take all your antibiotic until they're gone. Because if you just stop when you feel good, you've still got bacteria in there, and it's strong bacteria that hasn't succumbed yet. And so, you know, the weak and the sick bacteria is going to get killed off first. And then if you stop, you've got strong, healthy bacteria that is not going to go away. It's going to come back. Plus, now it's going to recognize this penicillin. It's been exposed to it. It's going to be able to mutate and become resistant to it. So it's essential that a patient takes all their antibiotic until the entire regimen is gone. If they can't, for some reason, if they develop side or adverse effects that make it too unpleasant to take, they need to call their doctor and try to get a new antibiotic. When you are administering penicillin, you want to make sure that you have a set of baseline vitals. Because remember, anaphylaxis can lead to a collapse in circulatory function. So if you've got somebody with a perfectly normal blood pressure, and then they get a shot of penicillin, and they start exhibiting symptoms, you want to take their blood pressure again and find out if it's dropped from a normal range to very low, which could indicate circulatory collapse. It's a good idea to observe a patient for at least 30 minutes after giving them an injection. Some places will say 15 to 20, but 30 minutes would be what I would be comfortable with one of my children, because most anaphylactic reactions are going to come up quickly. They're going to come up within about 20 minutes, and observing the patient for 30 minutes makes sure that they're probably not in anaphylaxis. Our book recommends giving penicillin Z-Track and aspirating before it's given to make sure you're not in a blood vessel. Evaluation, of course, would be culture and sensitivity, where you stop growing that pathogen, relief of symptoms, throat's no longer sore, fever's no longer spiking. One very important element of patient teaching is that if your patients are taking penicillin for sexually transmitted infections, they have to treat all their sexual partners. It's not going to do any good to recover from syphilis if you turn right around and get reinfected. So there needs to be an assessment of people who might also need to be put on that penicillin regimen along with the patient themselves.